Hello guys, welcome back to my channel Pharmaco Essentials. So today in this video I want to share about my experience as a clinical pharmacologist in HCG to all my juniors. So chalo, let's start. It's actually an experience as a clinical pharmacologist in HCG Suchirayu for a period of 6 months. It was a time when I was in my fifth year of Doctor of Pharmacy course and we had postings in KIMS simultaneously for our 6 months of clerkship activity from college as an academic part. Then, as the postings were till 1 p.m. in the afternoon, I had lots of time after that. So, I just thought that I will go for a part time so that I will be busy in some of the work. Then, what I did is randomly I took my CV and report card, whatever I had, and went with my dad to HCG. It was actually nearby my home. Then, we went and met the HR there. It was actually a different experience for me. I had never visited such big hospital actually. Then after meeting the HR, she saw all my marks card and even she saw my CV. She took an interview actually. I was actually scared because I don't know what will be asked in that interview. Then with lots of courage, I went near a ma'am. She was an infection control officer. Her name was Dr. Dipti ma'am. She took my interview, asked about antibiotics, antimicrobial stewardship, about my ongoing thesis, which was going on in the fifth year. I just confidently finished that round. The next HR ma'am took an interview. She asked all the questions from HR point of view for checking the point of interest, aptitude testing. Finally, all went well, and I was offered an 6 months internship as a clinical pharmacologist there. Working there was not an easy task for me. It was actually a very hard journey, finishing clerkship postings in KIMS, then run to HCG. But as I had taken the risk, I had the determination to complete it, and finally I did it. At the end, that completion letter with Dr. Aishwarya Vernikar successfully completed her 6 months internship as a clinical pharmacologist in HCG. That was literally my first experience letter. Felt actually very happy. Working there was a different experience for me because I had my postings in KIMS, which was a government setup, and working in a private HCG with totally different workflow, the way of patient care. At the time, I came to know the meaning of an NABH accredited hospital. Working pattern of a clinical pharmacologist in NABH accredited hospital, the cooperative quality maintenance gave me the best experience. I literally had a new learning phase there. At the beginning, I was very much confused with all the brand names of the drugs because I usually read all the generic names in the KIMS. But slowly, we had a clinical pharmacologist, Dr. Jesna ma'am. She strictly made us learn all the drugs, that auditing works. Suppose if the medication error occurs, how to present it to the consultants, how to carry on the on job training for the duty doctors and nursing officers. It was really a worthful journey for me. The period of degree, no, actually, it's a very good learning phase. So, learn as much as you can because once you start working, no, there will be nothing learning, just implying what you have read or what you have experienced. Simultaneously, I will share a link below in which all the roles and responsibilities in the internship period or what we learn in the internship period has been mentioned. It's to all my juniors. Don't stop your learning. Try to learn new things wherever you get the opportunity. All the best.